Well, good morning, everyone. I just wanted to say thank you to the Sinclair team. What a great event. Each one is better than the previous. So I'm happy to be here with an esteemed panel of colleagues and to be here with such brilliant minds. I'm here to just basically kind of tell you my story and our story. I'm Dr. John Hendrickson. This is my wife, Michele Hendrickson. I'm a general dentist. I've been practicing for 26 years. So let me ask you this. We're all professionals. Who really enjoys going to the dentist? Raise your hand. Yeah, I got one. I got one taker. Yeah. So that's true. I mean, I think most facets of healthcare are a little difficult for most people, but especially dentistry. It's a very personal space. But with that, you get to know your patients very well, and they get to know you, and you get to have a very nice relationship with them. So we started out together as a team. We went to high school together. Went to Ball State University in Indiana together, got our exercise science degrees together, went to Indiana University School of Dentistry together. So then then started our career together. And there's the happy couple there as we started out. As you can see, 1991. A car accident led us to be interested in dentistry. She was the victim of the car accident, injured some teeth, and then we ended up in dental school. Short story. So here's a beautiful sunset in Trafalgar, Indiana. That's my office there. It's a small rural town. Grew up there. Had a lot of opportunities with friends and families to start out with. Got into studying orthodontics comprehensively, so for 21 years, that's what I was doing. That was my gig. General dentistry, orthodontics, digging my heels in, not really thinking too much about anything else. And then, of course, while we're building career, we're building family. And that's kind of where Michele stepped out of the business and into the home realm of homeschooling and an educator for others in the private sector. And so I would like to turn it over to Michele to tell, so she can tell her.
Yeah, I'll kind of tell my story here. So, we have 4 children, and like you said, we kind of tend to go all in on everything we do. So not only did I homeschool, but I helped start a homeschool academy that homeschooled 200 other students, and helped start a football program and a cheer program. And so we were all in doing all this, and all that being just totally absorbed into our children and their lives left me very depleted. And I feel like I woke up and looked at myself in the mirror one day and was like, holy cow, like I have done very little other than, go to the like stores in the mall and what I thought was buying good skincare and so forth, but really had not done anything aesthetically. And so I had a hairdresser who, she went to a dentist and got Botox after hours, and I was like wanting to get in on this after hour dental party, and my husband called me and said, hey, there's a training course for Botox in Indianapolis. Would you like to go? I need to have a patient. And I said, absolutely. So this is the first picture up there. That is me at our first Botox course, course flexing that glabella, and I think I have striations on that frontalis there. And then the next picture here is kind of, because I think after you get in this field, you kind of start looking at everybody's face and diagnosing them and how many units they need and what they need and so forth. So recently I did a post where I had my face, and that was kind of everything I'd had done, and if that woman walked into our office today, that is what I would tell her she eventually needed done if she were interested in that kind of thing. So so that's me. And so then, yeah, we jumped all in with facial aesthetics. Most of the training was through the AAFE and then some other independent courses. And we just fell in love with the whole field and just went all in and wanted to be able to treat comprehensively. And the Sinclair, which were then Viora devices, were the first devices that we bought. And that really let us give just a comprehensive treatment to our patients, because there was definitely, as you know, limitations with Botox. As we all say, it's kind of the segue drug, and that was great to start, but we couldn't address all of our skincare needs, especially we live in a very rural farm, lake community, so tons of sun damage. And so our first purchase was the V20, and we absolutely love that device, and I would say it still is the backbone of what I do. I do all the laser and facial treatments, and it still is the backbone of our practice for that sort of service.
Yeah, so 2018 is when I kind of started into facial aesthetics, and then, as you know, soon after that, we had a bit of a shutdown where I took quite a few more courses in a virtual manner at that point, and then we formulated some plans as to how we're going to do our new opening. I knew that after 21 years of general dentistry, a bit of burnout set in, and that was my career. I love it, but looking for something fresh, and that's kind of where we really fell in love with the facial aesthetics. And again, going all in, I wanted to be able to offer, everything I could for an individual. If they had something they needed, that I couldn't do, I felt embarrassed. So I wanted to further my career and studies to be able to offer everything I could. So I'm not one to just dabble. I think that, we see a lot of dentists who are just dabblers, do a little Botox here and there, but I offer a comprehensive treatment with facial aesthetics as well as dentistry, and it really works hand in hand. I'm not really pushing the dentistry. I'm here to kind of talk about the fact that any of us can integrate this into our practice. It's nice and easy, and the patients love it. I asked the question about who likes to go to the dentist, because I don't know how many times I've heard, I hate the dentist. No offense, but I hate the dentist. But yet I can sit there and do 100 injections in an individual, and they thank me for it. So, you just can't beat that. Not only that, it's very gratifying to see the results of, good treatment, and you know what's good, you know what's bad, so we like to think that we offer good treatment. So I had really great training. So this is Dolly Vita. We created a company within our company, a DBA, Dolly Vita Aesthetics, which basically Michele and I and Katie. Katie's our daughter, business manager, entrepreneur, boss lady for sure. I wore that hat, boss man, for quite a while, and was happy when Katie was able to come on board and allow me more focus on my clinical aspirations, and then and she keeps the ball rolling and enable me to do so. So these are just pictures, as you can see, from the very beginning, graduating dental school. There was Katie right with us the whole time, Yeah, we had a little resistance with our staff, even with the community. Nobody really knew what we were doing. We knew what we were doing. We knew our goals and aspirations, but everybody wasn't really on board until they started seeing some of the results and started seeing that out of the 11 operatory chairs for dentistry that I had, one chair that we ran our facial aesthetics out of became 43% of our revenue. So, obviously we were onto something there, and that's cash basis. And so it really, was a nice adjunct to dentistry, where there's, insurance pay and a lot of resistance in treatment in that regard. So that was a big, huge bonus for our company. So, continuing my education, with a comprehensive plan in mind to be able to treat everything that I could, and then continuing with our brand development. looking to increase our social media presence, and then of course, getting notoriety through just the fact that we set ourselves apart with our energy devices, as well as our injectables in a dental type community.
I think that's a video.
All right.
I think this is a video that should play. Yeah, this.
No.
We practiced. So this is just a video, a fun video. Social media has been a lot of fun and a great way to promote our aesthetics. And so I do our social media mostly and have a lot of fun doing it. And any of you who do social media.
These are my lady.
Oh, here it is. Yeah.
This is Jill. This is my lady Amy. Little Susie. Brianna. You know why we call her Brianna, right? Yeah, it's a long story. Shaniqua, Helga, Miss Kitty, Jeannie. I dream of Teresa. This is Teresa right here.
So I have a lot of fun. I am so passionate about what we do and the aesthetic devices, and so I have a lot of fun on social media, usually doing funny things like that and making fun of myself a lot of times, but also trying to educate people in a fun way and make it relatable and something that everyone wants to come in and
These
do.
are my ladies.
Oh, it's playing again. Oh, so and then the other piece to kind of taking it to the next level was we branded our own skincare line, and so we introduced that about a year and a half ago on May 4th in 2022. And I wanted to have a skincare line that we could treat all sorts of skin types with, and something that I could really stand behind and see results. And if people were spending, quite a bit of money on medical grade skincare, I wanted something that they were going to love too, and something that I believed in, and not, oh, I know you sold me that bottle of serum for $175, but it balled my makeup off and came right off, and so I don't like it. And so I was determined to find something that I love, that I believe in. I use this twice a day, have now for a year and a half, and absolutely love it. So that is kind of what that slide's for, yeah.
So, as a result of all this coming to a head, we do all forms of injectables, threads and biostimulation, laser treatments and skincare. Again, the complete med spa package is what we had in mind to do, and I think that that's what we're doing. We're still a dental office, but it's been well received, and we're growing exponentially. It's my 5-year mark as being an injector, and I feel like I've really been able to, gain a lot of insight as to, the industry. Perspective from dentists, I think, is kind of unique. We've attended a lot of courses, and all types of medical people falling into this category of injectors. So I'm glad to be representing dentists. I think that, just like anybody else, you can find a good injector and you can find a bad injector. I think that I'm a good injector. So I bring my walking billboard with me. She's been there with me for every course I've taken, and been my subject for all of guinea pig, so to speak, for all of those procedures. Here's a couple cases. Just being able to offer comprehensive treatment, as you can see, before on the left, after on the right. Combination of good skin care, lifting threads, injectables, some fillers here and there, neuromodulators, the whole bit. But I think that it's a nice result, and certainly the patients are happy with that.
Yeah, and I'd like to just say too, and as I've heard over and over again this weekend, how this field is really going towards a bioregeneration type movement, and especially I would say in our demographic, we are a very small Midwest town, and one of the greatest fears that patients have is that they don't want to look overdone. They don't want to look like, well, I'm not going to look like that movie star, am I? And all this stuff. So they want a natural look, but it's always that fine line. I think it's hard where patients want to see results, but they don't want to look overdone. So, they want us to do that just perfect, right? And so we always strive to be perfect. And these kind of cases, I think, are great to show people that, how it can look natural and just rejuvenated, and they still look like themselves. And when you get cases like this, if it's okay for the patient to, approve you to show, it's like you can sell so many cases when you have pictures like this, because, that's what I'm looking for. I just want to look rejuvenated. This is an acne case that we used to have a video in here. We don't have video, but I'm really proud of this case because she had severe acne and was really had some acne scarring and active acne, and was really impacting her life. And just with the aesthetic services, she was able to get that cleared up and feel really good about herself. And this is another. The female patient there, she's a unique story. She originally sought us out for therapeutic Botox. She had long-term COVID symptoms and went to Johns Hopkins, and because of her lingering headaches, they said go back to Indiana, find an injector that does therapeutic Botox. So she found us, and she originally started out with therapeutic Botox, and then just fell in love with everything as much as we have. She's really an ambassador for our for everything, our services and our skincare. And she just looks and feels so good and loves to share her testimony. She's very transparent. And then this is Dr. John, obviously, and even the men. We are seeing more and more men in our practice, and so I like to show people how even the men can look improved and more rested, but still look masculine and natural if that's their goal. So yeah, and I think this is a little video, a funny little video of myself, kind of where I started and where I am.
I'm proud of the woman I'm becoming. My mindset has changed, my priorities have changed, my taste has changed, my tolerance has changed. I'm evolving.
Yeah, so a little time lapse of kind of where my journey's been over the last 5 years.
I'm proud of the woman I'm.
So we say aging in reverse, or well aging.
Well aging.
Yeah.
It's a good term.
Yeah.
Yes. So as I mentioned,
sorry, go ahead.
I mentioned, our revenues just out of one room, 42% of our overall, which is really saying a lot, considering all the procedures that I do for dentistry. You have any more to add to that?
No, and then we recently, and I don't think we have a picture of it up here, but we recently expanded. So we were a family dental office. It was called Trafalgar, which is our hometown, Trafalgar Family Dentistry. And then we rebranded to be this dental beauty wellness center where we could tie all these things together. We are always growing, expanding, learning. So the dental, yes, that's been there for over 20 years. The beauty, we expanded into the facial aesthetics. And wellness, since we were at our last Beauty Boss, we have a nurse practitioner that now rents space from us, and she is providing well care, hormone replacement therapy, medical weight loss, IV hydration, mental health counseling, those kind of services. We have a daughter who's a hairstylist. We've talked about adding her to our dental beauty wellness center. And then Dolly Vita is our, what we like to call aesthetic boutique within our dental beauty wellness center. And our next kind of plan would be to take that in a microsite location and try to expand our services to another location. So that's kind of where we've been, where we are, and where we're going. So
Yeah, well, thanks everyone. Really appreciate your attentiveness, and hope that you take away something either from our lecture for anyone else that has been up here. I know that we certainly have gained quite a bit of information just in the short time this weekend, and then the previous beauty balls that we've attended. We've already incorporated some of the things that others brought to the table. So it's a great learning environment, and we certainly appreciate being a part of it. So thank you very much.